I'm Tammy Johnson. I'm here to show you the skill on unconscious mouth care. Now you've got to be very careful on this skill because students tend to get unconscious mouth care mixed up with denture care. Be sure that you know the difference. On this skill, you will have a towel or a washcloth, gloves, Emerson pan or kidney basin. See, it's shaped like a kidney. Curved side always goes towards the resident. Chapstick, and a cup with imaginary water in it, and your tooth aid or your mouth swab. So you just kind of dip it in there to get it wet. And as you're dipping and cleaning, then the mouthwash that's on there disappears, and then you have a clean swab to clean with. Now, in this video, we're using one, but in real life, you might use several mouth swabs, okay? So we're gonna start, and here we go. Hi, Miss Jones. I'm Miss Tammy. I'm here to give you mouth care, hand hygiene, and pull privacy curtain. Now the next step is a critical step. If you do not do this step, you will fail. And you raise the rails. On this side, you walk around and you raise the rails. This side, come back. And then you raise the bed to a good height for you. I should not at any point see you bending over or tippy-toeing. So you've got to find just the right comfortable height for you. Now put the rails down on this side. And then I'm going to put my gloves on. Now in this skill, she is going to need to be placed in the lateral position, which is the sideline position, in the middle of the bed, because if I turn her over now, she's going to be dangerously close to this side. So when you need to turn, and we turn residents, we flip hamburgers and we turn residents, please remember that. Any skill that we have to put them in the lateral position, you're going to have to move them, whether it's away from you or to you. But I'm going to put her to me, so in segments, upper, middle, and lower, and then we always use the shoulder and the hip to turn her. Now at state, if she doesn't stay up, whoever your state instructor is will come around, or they'll give you a pillow. So you won't have to worry about that. Now that is a critical step. Turning them to the side is a very critical step, but the one that most students miss the most is saying that you're going to turn their head well down to the side. You're going to really have to say it because some of the mannequins' heads do not turn. Going to put the towel under the mouth. I like for you to keep your table close to you. Sometimes I see you guys stretching really far, and that table should be really close to you. I'm going to put my mouth swab. These are not called green thingies or pink thingies. They're mouth swabs or tooth aids. Get that wet. Take your Emerson pan. I don't want it touching the bed or touching the resident, and put it in the mouth. And you don't really have to put it in the mannequin's mouth. You can just kind of go on the outside, but you do have to say each step that you're cleaning. I'm cleaning the teeth or the chewing surfaces. They're either going to have their teeth, their natural teeth, or their gums. I'm going to do the roof of the mouth, the cheeks, the tongue, and the lips. Now that was washing it, and now I'm just going to rinse that area. That's all you have to say. You don't have to repeat everything. I'm going to put this down. I'm going to put chapstick on, and I'm going to remove a towel. And if you remember in my other videos, every single time you remove a towel or you remove a bed protector, that is when your gloves go off. So this will go in the hamper. You remove your gloves. Be sure that you're removing them correctly. Put them in the trash. And now we're going to turn her back in the supine position. Supine's on your spine, but she's not comfortable, nor is she straight. So I'm going in segments. I'm going to move her till she is comfortable. I'm going to cover back up. You don't have to do that. I tell my students to try to put the mannequin back into the position the way that you started if you can, but you You don't necessarily have to. The rail goes up, and if you do not put the rail up during this part, you will fail. Lower the bed. And you lower the side rails because that's critical steps too. Come around to your other side. Lower the rails. Very important. I know this patient is unconscious, but we always talk to unconscious patients to let them know what we're doing. But they still do get their call light. Hold your hands up, say hand hygiene, and report and record. Thank you.